All right, welcome back. We are at part two of sudden illnesses, part two, as well as stings and bites. Now we're looking at injected poisonings. We just left off there with our four types. We had ingestion, inhalation, absorption, and now we're at injection. So through a needle or through a bite or something like that. We want to look for those points of entry. So we look for a needle stick. We look for a bite. We look for a sting mark, something that gives us evidence that there's a problem. So sometimes a stinger can still be in place. Sometimes a tentacle of a creature could still be on the person. There could be venom then as well that we could see seeping from the wound. The skin could be very dry. It could be very painful and tender. There could be swelling around the entry site then too. Sometimes when people have allergic reactions to these different bites or stings, there could be a localized itching, hives, or a rash. There could be severe swelling. There could even be signals of anaphylaxis, which means that person is severely allergic to whatever kind of bite it is, and their throat tissue is actually starting to expand to where it could cut off their trachea, and they could no longer breathe. So that's the worst case scenario. If somebody is allergic, we want to make sure they have the medical supplies with them. We want to make sure that we contact 911 immediately. So general care, right? Look for life-threatening conditions, call 911 if necessary. In the meantime, we can use something like an ice or cold pack to help the affected area. And again, call 911 for anaphylaxis. Anaphylaxis, there's a good picture in your book though. There's a lady kind of hunched over and she's got like red blotches. She looks real pale, like trying to take in breath, looking fearful. These are all great examples of what it looks like for anaphylaxis. Is emergency 101. We call 911. So severe allergic reactions. We want to look at things like maybe the person could be severely breathing, right? Trouble breathing. They could be wheezing, having shortness of breath. They could have tightness in their chest leading up to their throat. We have those blotches. Call 911, best case practice. Once we contact 911, we monitor the person's airway and look for breathing changes because we might have to try to perform CPR. That means where we might have to force air into their mouth, right, to get oxygen and continue with compressions if there's no breathing, no circulation. Other than that, we can ask the person questions if they are conscious about what they might have ingested or injected into them, whatever it may be. And then, if necessary, right, if the person has a prescribed epinephrine auto-injector, we can go ahead and help them with that. So the main thing is with that pen, it looks like an EpiPen, right, a pen. Ask them if they have, do you have your EpiPen? Yeah, I do. Well, can I help you administer that? And they'll probably say yes if you tell them you're certified. Look at the pen and read it. The fluid, first off, should look pretty clear in the tube, and then it should say the person's name and an expiration date on that product. Once you've declared that that is for that person, what you're going to do is you're going to take that pen and you're going to go to their thigh, their outer thigh. So have their knee bent at an angle, and find about the midline here where it's a little thicker in the musculature. And you're going to take that pen and you're going to stick it into their leg and hold it there into the thigh for about 10 seconds straight. After those 10 seconds are up, you're going to remove it and you're going to rub that area with a gloved hand to help that chemical, that epinephrine pen, circulate into the muscular, into the bloodstream then as well, so that way it can help fight off whatever kind of symptoms are going on for that person. If those symptoms do not improve after the first 5 minutes, we have a really bad scenario. We want to make sure that we've called 911 by then. Usually the symptoms decrease after the EpiPen. It's a steroid, right? So the steroid's going to help them fight off that problem that's going on right now. For other poisonings, though, if we want to prevent them in the first place, okay, just general prevention of poisonings, right, for children, let's go ahead and keep those medications and household products out of reach for them. We want to keep them in correct containers, lockable containers, or lockable cabinets where they can't get to them whatsoever. So safety caps, safety devices. Always keep products in their original container and keep them labeled correctly, right? If we don't want to put ibuprofen into a Flintstones container, that would just be completely dumb. So we want to keep things in the appropriate container so people know what they could possibly be taking for different kinds of medical problems. If there is something that's poisonous in a container, it's usually marked. It has one of those maybe skull and crossbones little symbols on that. Good telltale that we should keep that out of reach of everybody. So very dangerous stuff. If we have any outdated medications, we want to dispose of those. We don't just flush them down the toilet. That's not the good practice to do. We can actually go to somewhere like a Walgreens or a CVS, and they actually have used medication deposits there in the back by their pharmacy. You can give them to them, and they will dispose of those things correctly to keep it safe. If we are using dry, dangerous chemicals or wet chemicals, any kind of chemicals at all that give off an odor or gases, we want to make sure those are well ventilated areas. So even if you're painting a bedroom, right, keep the windows open, keep the doors open, keep the air circulating so you're not getting a high from that, so to speak. If there's any area, right, that gets affected by any poisoning, right, we want to take off those clothes, wash off that area if possible, just to be safer than sorry. Now, jumping into bee stings and bites, right? We got those. Those are very common around these parts. As I said from before, you know, I had a number of students. I had Mike tell me about a bee sting to his lip. I had Ian tell me about a bee sting to his head. We had Nick swallow a wasp. We had what else? Amber got stung by 3 bees as well. She talked about her food poisoning episode too. Alex Cameron, 4 wasps. Wasp in your dad's helmet. That's what you said about that one. He had to pull over and pull off his helmet. I think, what else was there? I think there was a spider bite I heard about. Marcus, you were talking about bee stings to your knuckles when you're riding your bike, and that was very painful. Jacob with the diabetic emergencies that you've seen, and what else here? What other kind of emergencies are we looking at here? Yeah, just those are some good ones. Just a shout out to all you guys here listening. Let's get back onto the topic though. So bites and bee stings. We're looking at insects, we're looking at ticks, spiders, scorpions, marine life, snakes, wild animals, domestic animals even too. And last but not least, the ones that we're most in contact with, humans. Yes, humans do bite. Insect stings, 0.5 to 5% of American population, they are severely allergic to the venoms from bees, wasps, hornets, and things like yellow jackets. So that's why it's very important that we understand what could have stung them and that we get proper medical attention then after that. So signals, right? We look for, first off, we look for a stinger, we look for an injection site, right? Pain, swelling, and allergic reaction. Once we determine those things, we can go ahead and call 911 for a severe, highly allergic person. If we do see a visible stinger, we can try to remove that with tweezers, or you can also use the edge of a credit card. Say the stinger is in, you know, this general direction going in to the body. If we take a credit card and scrape the opposite way, it can sometimes pull the head of that out, so you can pop it out very easily then. So make sure you're wearing gloves when you're doing this, right? Because you don't want to get yourself affected as well while you're giving care to this person. But once we remove that stinger, if it's visible, we can wash the site with soap and water, cover the site, maybe apply an ice pack then to it. Look for any other allergic reactions, and if necessary, call 911 if things are getting more severe. For tick bites, okay, tick bites. Ticks are very dangerous. In fact, we can have one on our body for a number of days and it can cause even more problems than ever. So anytime we're in the woods, right, wear a ball cap or something like that. Check your body for ticks, check your skin. I've had ticks on my thigh, I've had ticks on my back, I've had ticks in my hair before just being out in the woods. So it's very important because these do contract a lot of diseases, and they carry and transmit diseases to humans, right? So if we do see a tick on somebody, we want to go ahead and wear gloves, right? We want to grasp the tick with tweezers. We don't want to, right, burn the tick off of somebody's skin. That's just silly. But we want to take tweezers, and what we can do is we pinch the head of the tick. So get as close to the surface of the skin, pinch the head of the tick, and I'd say give it either clockwise or counterclockwise twist. See, a tick, its teeth are made as pincers. And with those pincers, if we were trying to pull it straight out, it can sometimes leave the head intact, and then the whole body will grow again, and we'll still have the tick there. The best practice is to swoop the tick out, or when you grab the tick, give it a twist, meaning like a counterclockwise or clockwise twist at the head, and that actually causes those pincers to unlatch, and then the tick comes right off. And then stick the tick in something like rubbing alcohol, or if you're one of those pyros, go ahead and burn it up, but I don't recommend it. But like I said, rubbing alcohol should kill it in a jar. That's good enough to get rid of the tick. Then, of course, wash the site with soap and water, and apply some antibiotic ointment then just to protect it, keeping those reactions from happening. Wash your hands thoroughly right after working with these things, and if we see a rash or flu-like symptoms or joint pain, okay, these are reasons to contact medical professional help immediately. We have several different types of tick diseases. What I want to tell you though is that the main thing is we see the same symptoms over and over again. Number 1, the person has a fever. Number 2, they could have nausea or vomiting. Number 3, muscle aches and pain. So if we see any of these symptoms right there, we know that the tick has infected the person to a point where they need some medical help. We want to get them to the doctor as soon as possible. These signals can come on after a couple hours. They could come on after a couple days. The main thing is that once we identify them, we get that person some care. Sometimes with a tick bite, there'll be this thing called Lyme disease. Okay, that's one of the more common ones. In fact, I think Avril Lavigne had Lyme disease from getting bit by a tick. We look into that. What we'll see is what at the injury site where the tick was, it will look almost like a bullseye. In the center, it'll be red, then it'll be a ring of yellow, a ring of red. That's always a dangerous sign. We know that the tick is affected and there's a poison in the bloodstream. We need to get that person some medical help, so take them to the doctor immediately. Again, fever. We're looking at a rash that spreads to a larger size, a bullseye shape, muscle pain, weakness, reasons to call 911. We have mosquito bites, right? Those are very common. Usually it's not a big deal to worry about, but sometimes they could carry West Nile virus. With this, again, fever, headaches, muscle pain, stiffness. These are all reasons to call 911, get this person some medical help or seek medical help. For spiders and scorpions, of course, we don't have many scorpions, right? But we're looking at spiders. Spiders like the black widow spider, brown recluse, or the northwestern or hobo spider, they call those. Same thing though, it's hard to distinguish a poisonous versus non-poisonous spider. The main thing is that we look for the injection site, we clean that injection site. Now it could be severely painful or maybe not painful at all for the person. The main thing is that we're looking for the other symptoms like excessive sweating or severe muscle weakness. Maybe their eyes are drooping. They could be very restless. They could have rigid muscles, shoulders. They could have some pain going on then too. The thing is that pain sometimes usually develops more and more over time with these things, and it could even become like a blood blister. And then there could also be that target or bullseye pattern around that wound site. Definite reasons to call 911, get that person some medical help. Sometimes with like the brown recluse spider, it actually destroys tissue with its poison. So it'll eat away at the tissue and kill it all, and it'll turn black. This is a definite reason to get some medical help, because this person could be losing a limb. They could lose that body part. It has to be debrided and cleaned out appropriately, so get some help. Again, call 911. In the meantime, we can use an ice pack, wash the site with soap and water. If possible, we can transport the person to the medical facility ourselves. But keep that bitten area maybe elevated then in the meantime, right? Hold their arm maybe up in the air if that's the body part affected, just to slow down that poison. Other things then too, venomous snakes. Very few venomous snakes in the United States. Usually we have anti-venoms at most hospitals locally to 200 or 300 mile radius to that creature. So they can usually help. That's why we need to get medical help immediately with something like this and get some kind of anti-venom for that person. Examples of snakes would be like the rattlesnake, which is the most common, but there are copperhead snakes, cottonmouth, and coral snakes. There are great pictures in your book, so do look at those. They are examples of what they look like. But in general practice, if you get bitten by a snake, go to the doctor. Some snakes don't leave the same, just two pin pokes like a rattlesnake would, where the venom is injected. Some of them are more like a coral snake, which would be a semicircular shape with a bunch of little teeth. So don't be confused, all snakes, we have to consider them to be possibly dangerous. So it's good to contact 911 or at least get that person some medical help in the meantime. There could be severe burning at that injection site. You could see streaks coming from that site towards the heart. If there's ever streaks, we know that we've delayed way too long. We need to go to get some 911 help. Call 911. They're going to need to rush that person to the hospital to get an anti-venom, possibly some antibiotics, maybe in steroids to help them fight off that quote-unquote infection going on. What we can also do in the meantime, maybe while we're waiting for 911, if we can't transport the person, is say they were bitten on their wrist. We can put a pressure bandage around their forearm or their upper arm to slow down the poison from coming up towards their entire circulatory system. Let's see here, and then of course if we can transport the person to the hospital, best case scenario, get them some help. Marine life, I know that's not really going on too much around here, but if you go on spring break or somewhere for the beach, we have to look at these aspects. Animals like sea urchins, stingrays, jellyfish. These are all things that could cause possible allergic reactions to where it can cause breathing and heart problems, paralysis, or even death. So it's good to know and look for these signals first, right? Possible puncture marks, pain, swelling, allergic reaction, maybe the creature's still on the person. Anytime we have a marine life sting, we want to contact 911, or at least get the lifeguard on duty. Sometimes they know the remedies right off the bat, and they can help you out a lot. So contact the lifeguard, get that person to remove the person from the water if necessary. Use a reach assist if you can't get to the person safely. Never touch them with your bare hands, right? Wear gloves, use towels to remove structures off the person. For a sting, like a jellyfish, what we want to do first and foremost is irrigate with large amounts of vinegar, actually, for at least 30 seconds. So vinegar is going to be a great remedy for a jellyfish. If there is none of that available, you can use baking soda, so baking soda and water, and that can sometimes flush the wound then too a little bit. Other things that we can also do, if we don't have those on hand, you can just use ocean water to irrigate the wound. We can also then have the person, once the stinging stops or once the tentacles are removed, have them take a hot shower for about 20 minutes, and that can remove some of the poison from the skin. For other things then too, again, just other types of creatures, stingrays, sea urchins, spiny fish. Flush with large amounts of tap or ocean water, and then keep the injury part still. That's going to be very good. We can also soak the wound in non-scalding hot water or pack in hot sand for at least 20 minutes or until the pain goes away. That seems to be a good remedy. Clean the wound and apply a bandage, and watch for signals of infection. First thing, right, we got fever, redness, tenderness, swelling of that injury site. Sometimes the healthcare provider will recommend a tetanus shot for these creatures biting you. And then going into domestic animals and wild animals, they can often carry risks of infection or soft tissue injury. So rabies is the most common infection we're looking at. If it's not treated, it can be very fatal. In fact, anyone bitten should contact medical professional help immediately. Vaccines are given to prevent rabies, so make sure you go to the doctor, get some help with that. They might give you an antibiotic as well as a rabies shot and maybe even a tetanus shot. I had one student tell me about that. It was Madison, the dog bite for your grandpa, right? He had to go to the doctor, get it cleaned out really good, get an antibiotic. I think she said it was a tetanus shot then too, just to make sure things were safe. Other things now too, if a person is bitten, right, we don't want to put ourselves in risk if the animal's still there. We want to make sure that we're not endangering ourselves, so call 911 if necessary, call a local emergency number if the wound is bleeding severely or you suspect rabies. Remember, we are only certified to give basic care. If it's a basic wound, we can deal with that. We can clean it, irrigate it. But if it's a severe wound, we contact 911 right away. We put pressure on the wound to keep it from bleeding, wait for medical help to arrive. If the animal ran away, right? Remember the appearance of the animal, so that way the proper people can go find that animal and prevent it from hurting others. General care though, for bites, control bleeding first and foremost, especially if the wound is bleeding severely. Okay, and if the wound is a severe wound, we do not clean it. We just hold pressure on it, make sure we call 911, get them to take care of business. If it's a minor bleeding wound, we can go ahead and wash it with soap and water. We can irrigate it with soap and water. We can control any bleeding if necessary, and then cover the wound with dressings once it's dry and apply an antibiotic ointment in the meantime, and then watch for those signals of infection. Remember, contact your medical professional if necessary. Human bites are very common. In fact, I got bitten on the school bus one time. Thankfully, I was wearing a jacket and the kid's tooth popped out. He was 9 years old, right? He started crying like a baby. It didn't hurt me at all. But if I wasn't wearing that jacket, he could have maybe bit my skin, right? Drawn some blood, possibly. Now, people may get contaminated. It may be even be a delayed onset kind of infection going on, because again, our mouths carry a lot of bacteria too. So oftentimes we want to make sure we are taking care of the wound, we're cleaning it first and foremost and putting an antibiotic cream on it then too, and watching for those infections. The culprits of bites are more often children, right? Children on children biting each other because I have no way else to let out my energy, I'm going to bite you, right? So these are oftentimes the recipients and also the inflictors, to look at those possibilities. But again, same care for humans as animals, clean the wound. If it's minor, if it's severe, we call 911. That'll do for this time, this go around. For class, next week we're going to be covering, so that would be 421 of this semester, so April 21st, substance misuse and abuse, as well as heat and cold related illnesses. So your homework this time, okay, one little thing. All I want is one full paragraph reply back to me stating some of your maybe experiences with either a substance misuse or abuse, Maybe you observe somebody else. You don't have to talk about yourself if you don't want to. And then maybe a heat or cold related illness then too that you might have had experience with. All right. I'd love to hear your information. I'd love to hear what you guys have had experience with it. That way I can give you a little shout out during the video. Make sure you are subscribing to my channel if you can, or saving it, whatever you can do for that, so that way you're not asking me 100 questions. How do I get to the video? How do I get to the video? I don't know how to get back to it, you know, whatever it is. You have all my videos right there on the same channel, so if you need some practice, need some remembrance of what to talk about, what to know about, check out the other videos. They're always there for your disposal. Any questions, you know, go ahead and send an email then as well about if you need some clarification on some material. Other than that, I hope you all have a great week. Stay healthy out there, stay safe, and we'll see you soon. Thank you so much. This is Kyle Fogel signing out.